Hello and welcome back to our channel. We are back with another episode on rare diseases. In today's video, we will be focusing on Erdheim-Chester disease or ECD. So, if you're curious about this lesser-known condition, stick around as we dive in and uncover the facts about ECD. Let's get started. Erdheim-Chester disease is an extremely rare disease characterized by the abnormal multiplication of a specific type of immune cell called histiocytes. These cells accumulate in various tissues and organs in the body, including the long bones of the legs and arms, skin, tissues behind the eyes, lungs, brain, pituitary gland, kidney, abdominal cavity, the membrane surrounding the heart, heart muscles, blood vessels, adrenal glands, and more rarely, other organs. While the exact cause of Erdheim-Chester disease remains uncertain, recent classification by the World Health Organization has classified ECD as a type of blood cancer known as histiocytic neoplasm. More than 50% of patients with ECD have been found to test positive for the BRAF V600E mutation on tumor cells. In addition, chronic and uncontrolled inflammation play a significant role in the disease process. However, it is believed that this inflammation is a result of the body's immune response to an underlying process in the disease, rather than being the primary cause of the disease. Erdheim-Chester disease was first described in the medical literature in 1930 by Austrian pathologist Jakob Erdheim and American pathologist William Chester. Since then, only a limited number of published cases of ECD have been reported worldwide. Due to its rarity and absence from common medical textbooks, many doctors may not be familiar with ECD, making it difficult to diagnose. As a result, it is believed that ECD may be underdiagnosed. However, there has been an increasing trend in the rate of diagnosis in recent years, and efforts are being made to better understand the pathobiology of ECD, stratify patients based on risk, and develop novel treatment strategies. Erdheim-Chester disease typically presents in adults, usually between the ages of 40 and 70, although it has been diagnosed in children as well. Both men and women can be affected by ECD, with approximately 60% of reported cases affecting men and 40% affecting women. The signs and symptoms of ECD vary from person to person depending on the specific locations and extent of involvement. For example, the long bones of the legs and arms are commonly affected, leading to bone pain. Leg pain is commonly reported in the knees, shins, and ankles, while arm pain is often in the upper arms. This is the most frequently reported symptom in ECD patients, although some patients may not experience bone pain. When tissues surrounding the eyes are affected, it can cause the appearance of soft, fatty bumps on the eyelids or bulging of the eyeballs, which is medically referred to as exophthalmos. Additionally, vision difficulties such as bilateral fluttering in the peripheral vision, double vision, reduced vision, or other vision disturbances may also occur. Lung involvement may cause pulmonary fibrosis, which can lead to severe complications. This can manifest as coughing and difficulty breathing. People with pituitary gland involvement may develop diabetes insipidus, irregularities in menstrual periods in females, and decreased sexual libido or orgasm in males and females. Nipple secretions in the absence of pregnancy or childbirth may also be due to pituitary gland involvement. Brain involvement may lead to various neurologic symptoms, such as balance issues, difficulty walking, slurred speech, and involuntary, rapid eye movements. Pain in the lower back, flank, or abdomen can be a symptom of kidney issues like retroperitoneal fibrosis, which may result in a decline in kidney function. This decline in kidney function can impact different aspects of kidney performance, such as urine concentration, waste removal, electrolyte balance, blood pressure regulation, and calcium metabolism. Patients with ECD may also experience skin rashes and increased susceptibility to infections. Nonspecific symptoms such as weight loss, fever, night sweats, muscle and joint aches, discomfort, weakness, fatigue, and flu-like symptoms may develop in people with ECD and may persist or recur over time. ECD diagnosis is often challenging and requires medical expertise. Patients may go years without a correct diagnosis. A definitive diagnosis typically involves a combination of clinical symptoms, biopsies, and imaging scans. Molecular testing of biopsies is becoming more common, with many patients showing genetic mutations. These mutations are acquired and not inherited, so they do not pass through generations. Therefore, it is important for patients with suspected ECD to seek care at specialized centers with expertise in multiple subspecialties for an accurate diagnosis and timely treatment. While specific diagnostic criteria exist, a detailed discussion of the process is beyond the scope of this discussion, as the purpose of this video is to raise awareness of the disease. There is no definitive cure for ECD, although there is ongoing research for more effective treatments. The current available treatments aim to control and sometimes shrink the disease-associated growths. It is important to note that not all patients with ECD require immediate treatment. Some patients can be monitored without treatment for extended periods of time, ranging from months to years. Therefore, patients and their healthcare providers should have detailed discussions about the indications for therapy and treatment options to determine an appropriate treatment strategy. Most targeted therapies used to treat ECD have potential adverse effects, and therefore, the risks and benefits of therapy should be thoroughly discussed before selecting a treatment approach. Several doctors have documented their findings regarding a specific treatment plan for ECD. However, I will not delve into the specifics of potential treatment plans, as that should be discussed with your healthcare providers, as they are best equipped to provide individualized treatment recommendations. Historically, clinical trials for ECD have been limited due to the rarity of the disease. However, this is changing, and there are now several studies and clinical trials available for ECD patients. Participating in a clinical trial provides access to cutting-edge treatments and allows patients to contribute to the scientific understanding of ECD. Clinical trials can pave the way for scientifically proven effective treatments for ECD, which can lead to approval and wider availability of treatments for all ECD patients. It is encouraged for patients to discuss with their medical team whether a clinical trial would be suitable for their individual situation. Thank you for joining in on today's discussion. Remember, you're not alone in this. Rare diseases may be called rare, but they're more common than you might think. Dealing with unexpected challenges, coordinating care, and managing financial concerns can be a lot to handle. Coping with a rare disease is an ongoing process, and your needs may change over time. But don't worry, there are resources out there to connect you with practical, financial, and emotional support along the way. One such organization is the ECD Global Alliance, which is dedicated to awareness, support, education, and research related to Erdheim-Chester disease. You can find their link in the description. If you found this video helpful and informative, don't forget to like the video and subscribe to the channel. And if you haven't watched the previous episodes on rare diseases, you can find them here.